So my computer was about to die, so I needed to plug that in. So we will go back to doing the gastro urinary assessment. So we're listening to the bowel sounds in each of the quadrants, listening for those clicks and gurgles, 5 to 30 per minute. If you don't hear anything, then you need to listen for a full 5 minutes in each quadrant to make sure. And this patient did not have any sort of surgery on his stomach area, so we should be hearing the clicks and gurgles. Over there.
I could hear it.
And you'll listen for 30 seconds if in each quadrant if you do hear the sounds. So then we would, after listening, we would palpate the stomach area for any pain, tenderness, any masses, lumps that might be there. And then you're also just overall assessing the stomach for any scars, any abnormal lesions that might be on the stomach, things like that. And overall, again, just checking the respiratory rate of the patient. So then we'll have them sit back up. Again, you can put your legs over. And again, the patient is able to do that on their own, so we are taking note of that for the musculoskeletal assessment. We're going to assess the arms and legs. We will assess capillary refill, so you'll want to do it on each hand and each foot. And you want it to return within 3 seconds. You're assessing for any edema, any swelling, any pain of the skin. The skin feels warm to touch. It's dry. Overall assessment of the skin. You can assess so that would be a part of the nail assessment too. We can assess the head while he's sitting up. You assess just overall normocephalic. Cannot talk right now. There are no lesions on the scalp. There is no vermin, no lice noted on the patient's hairline. The hair is adequately lubricated and equal in distribution for thickness. So then we assessed the eyes for Perla, and we also assessed the motion of the eyes. We can look in the ears. Checking the ears for any swelling, asking them if they have any pain in the ears. You want to see the cone of light in each ear, making sure that the tympanic membranes are not disrupted. Making sure there's patency in the nose. You can have them, if you want to look up a little bit, looking in the nose. We already assessed the mouth, assessed the mucous membranes. So for musculoskeletal, you can have them move each of their joints. So we'll have you move this arm first. You just move it up and down. Any pain with that?
No.
Okay. Next arm. Any pain?
No.
No. You want to move this leg out? Any pain?
No.
Okay. This leg. Any pain on that?
No.
Okay. So patient is not experiencing any pain. We would check all of the pulses, or not all the pulses. We would check the radial pulse, on each hand. And since this is a focused assessment that is based on the respiratory system, we do not need to check all of the pulses, but if you check the popliteal pulse on each side, then you know that there's adequate blood flow throughout the body. You check that. Check the other one. Okay. And then you can assess the skin. You want to make sure that there are no red marks. You want to look for signs of pressure sores that could be forming. If they just came in, you want to make sure that you want to know any pressure sores that might already be there. You can check their feet, make sure that they have adequate circulation in their feet. You're checking for any IVs that the patient might have. And if they do have IVs, then you need to make sure that they aren't having any pain with them, that there's no redness around the area, any swelling around the area. Yeah, so we did the respiratory assessment first. The reason we did that was because we wanted to make sure that everything was adequately working there, since that's what the patient came in for. So we're done with the assessment. We can put the bed down, get the patient their call light, see if they need anything else, and then gather the equipment and clean off all the equipment, do hand hygiene, and then you would go document everything.